Hello, today I would like to explain some materials about the adaptive disorders of growth and neoplasia. These materials is part of the practice sessions in Veterinary General Pathology. Uh, on these materials, I would like to explain about some evidence or morphological characteristic of disorder of growth and also neoplasia or tumor. So first, you already familiar with terminology cellular adaptations. So cellular adaptations is a kind of response, cellular response against many abnormalities, against many insults, whether it is a infectious or also non-infectious causes. So some insults on cells will affect the cell's morphology. Here you can see this is the normal cells. Normal cells uh, consist of nucleus, cytoplasms, and normal cells will be attached to the basement membrane. So cellular insults, or we can call it stress or something that can cause disease, will invoke a series of response from cells. Okay, so the cellular response can be changes in the size, number, structures, and type. So here, for examples, there will be atrophy. Atrophy is shrinkage of cell size. So it can happen for many causes. And then also it can be hypertrophy. Hypertrophy usually related with increased size of cells. It means that the causes of hypertrophy usually make the cells work more. And then there's also increased number of cells. We call it as hyperplasia. So this is all atrophy, hypertrophy, and hyperplasia characterize the changes on size and also number of cells. However, the compositions, the shape, or structural changes can be happen as well as response for many stress or insults. For examples, there's what we call as metaplasia. Meta means changes. This is changes of one cell type into another type of cells, or we can call it replacement of cell type. For examples, from a columnar epithelium can be changed to squamous epitheliums. Metaplasia can happen for many causes, usually chronic irritation, chronic inflammations can make changes on the type of the cells. And then also changes on the structures of cells can be seen as well in cases of dysplasia. Dysplasia is disarranged growth patterns of cells. Yeah, here you can see this is an abnormal cell growth. Usually dysplasia related with changes on the structures of cells. So there will be abnormal, or we call it bizarre, changes on the shape of the cells. So for examples in dysplasia, we can confirm dysplasia by looking under microscope. Here, For example, here, this is normal cells. In general, the proportions between nucleus and also the cytoplasm in cells is around 1/3 or 1/4. One part is nucleus, 3 or 4 parts is cytoplasm. However, in cases of dysplasia, the shape of the cells will be different with the original cells, and then the proportions of the nucleus and cytoplasm will be abnormal as well. For example, in cases of dysplasia that usually occur in epithelial cells, the proportions of nucleus and cytoplasm can be changed. For example, the proportion between the nucleus and cytoplasm can be 1:1. So the nucleus size is as large as the cytoplasm. Okay. That's one thing. And in cases of dysplasia, usually located in single or multiple part. Okay. So I'm going to give you some examples of the cellular adaptations that we can find during necropsy. It means I will show you some pictures as part of the practice materials, how to recognize some of the cellular adaptations, and later I also will explain and show you some pictures on tumor. Here, this is the atrophy of the cells. It can be on certain organs. In here, you can see the examples on atrophy of the testis. In front of you here, this is the testis. I guess this is testis from a dog here. So in here, there is bilateral atrophy in both sides of the testis, left and the right side. And see here, this is normal testis, and this is the shrinkage or atrophy of testis. So because it happens only on one side, we call it unilateral atrophy. So this atrophy usually characterized by shrinkage of the main tissue of the organs. If we talk about testis, the main tissue is what we call as seminiferous tubulus. Okay, so in cases of atrophy, we can find that when we make cut sections, when we do necropsy, we cut the organs. You can see that in organs with atrophy, it seems that the fibrous tissue here, the whitish part here, this is the fibrous tissue, will be thicker than normal. So for examples, you can see here in these pictures, this is normal testis here, normal testis. This is the fibrous tissue. And if you look here in the testis, in the testis with atrophy here, this is the fibrous tissue, the whitish part here. However, if you see, there are also some multiple whitish strands around this part, just like this one. And if you see, this is more pronounced compared with the normal one. Okay. However, if we would like to confirm it further whether this is true atrophy or not, we should also submit this tissue for microscopic examinations or for histopathology. So here, this is the microscopical characteristics of atrophy that we can see under microscopes. It means that we do the histopathological examinations. Here, this is the schematic pictures of the microscope characteristic of atrophy of testes under microscopes. Thickening of the fibrous tissue, we call it as interstitial fibrosis. This is the seminiferous tubuli here. So if the seminiferous tubuli become smaller, we can see the characteristic is here. This is the basement membrane will be thick and also decreased number of sperm of the main cells. In testis, there will be decreased number of spermatogenic cells. So here, this is the real histopathology. This part here, this is the Leydig cells. The Leydig cells become increase. It doesn't mean it increase in number, but the Leydig cell increase because when the testes become smaller, if there is shrinkage of testes, the positions of the Leydig cells will be closer to each other. Okay. Will be closer to each other. It makes that the border between the cells cannot be seen easily. You can see here, these are Leydig cells that close to each other, make the border of the cells cannot be seen clearly. And then this is the seminiferous tubuli with thickening of the basement membrane. And here there will be significant decrease in the number of spermatogenic cells. This one here, this is cases from dogs. This dog have thickening of the ventricles or the ventricular muscles of heart, thickening of the myocardial part of heart. So here, this is the thick part here. So thick part here, and we can see also if there is thickening of the ventricles, of the ventricular wall, the lumen of the ventricles will be smaller. Okay, will be smaller here. This is what we call as the concentric hypertrophy. Thickening of the walls of the ventricles, but with smaller lumen. However, in the right side here, this is also thickening of the ventricles. Okay. However, the lumen seems to be larger. This is what we call as the eccentric hypertrophy. So the size of the ventricular lumen become larger or similar with normal, with similar size. However, thickening happen. Thickening of the ventricular wall happen. So here, in this concentric hypertrophy related with usually chronic high blood pressure, okay, or prolonged high blood pressures. However, the eccentric hypertrophy, okay, wider or normal size of the lumen but with thickening of the ventricular walls, usually related with damage in the ventricular valves. Okay. If we talk about the left ventricles, it means that damage in the bicuspidal valve, okay, or mitral valve. So this is the microscopic appearance of hypertrophy. Hypertrophic appearance of hypertrophy usually related with increased size of the cells, or here this is related with increased size of the myocardial cells if we talk on heart. First, the characteristic can be the enlargement of the nucleus. Okay, enlargement of the nucleus, and then between the fibers of the muscles, it will be close to each other. So, for example, here, this is a normal fiber here. This is a normal fiber, but this one and this one, if you see, there are two fibers that are really close to each other. It usually characterizes the increased size of the fibers. Okay. So this is the main changes that you can see in the cases of hypertrophy. So between the muscular fibers will be close to each other because the size of the fiber enlarged. There's also other examples like the hyperplasia. Hyperplasia means increased number of cells. For example, this one here, this is the lymph nodes in dogs. Okay, this is lungs. This is what we call as peribronchial lymph nodes. This is the normal lymph nodes, and this one here, this is the swelling of the lymph nodes and lymph nodes enlargement. You will learn later in the systemic pathology. This is what we call as lymph adenopathy. So increased size of lymph nodes here. Lymph nodes usually filled with leukocytes, filled with lymphocytes, and also macrophages. So if there is increased size swelling like this usually related with increased number of lymphocytes or macrophages inside the lymph nodes. So increased number of cells means hyperplasia. So this is the histopathological or microscopical characteristic of hypoplastic lymph nodes. Okay, for example, here, this is the follicles of the lymph nodes. When you learn in histology before the previous masters, the lymph nodes composed of two compartments. First, what we call on the superficial part, or the outer part, we call it as the cortex. Okay, that's the same cortex of cortices. The cortex composed of lymphoid follicles. So it means follicles that consist of lymphoids, lymphoid cells. Lymphoid cells means lymphocytes and also other cells related with lymphocytes as well as macrophages. And in cases of lymph node hyperplasia, usually increased number will be related with increased size of the germinal centers. So this is one follicles. Usually the germinal centers is around the proportion of the lymph node follicles. The germinal centers with the surrounding tissue, usually it's around one part is germinal centers and two part are surrounding tissue, okay, surrounding lymphoid cells. But in cases of hyperplasia, the germinal center will be expanded. Germinal centers, size of germinal center will be increased. As you see, this is the germinal centers. This is the surrounding lymphoid cells. Yep, it's not 1, 2. Maybe it's 1, 2, or sorry, the normal is the proportion 1 to 4 or 1 to 3. But this one here is less than that. Okay. And then this is the medullary part of the lymph nodes. usually medullary part should be empty like this, filled with spaces. But in here, the spaces filled with these purple cells, filled with the lymphocytes and also macrophages. This means increased number of the cells can be seen both in the cortex and also the medullary part. Here, this one is the metaplasia of the rete ovary. So this one is ovary, but covered with the fatty tissue. So if we cut here, this is the ovary, and this is the rete ovary here. Okay, and then there is also in the rete ovary the cystic formations. This is abnormal. So if we look with histopathology here, if we look with histopathology, so usually the rete ovary composed of columnar epithelial cells, but in here the epithelial part of the rete ovary changes from the columnar type into what we call as the squamous type. It's like this one here, and even also the the cyst filled with this one here, the keratin materials. Okay, so columnar type change to squamous type. So I will zoom this part here. Here, squamous cells. This is not normal. So it means it reflects the metaplasia. Columnar type or cuboid type change into what we call as the squamous cells. Okay, this one kidney of dogs, I guess. Okay, so this kidney, can you see there are multiple cystic with variable size here. Okay, so yeah, microscopically we call this as the multiple cyst. However, when we look on the histopathology, this is the cystic formations. Okay, this is the cystic formations, but if you know the normal structures of kidney that compose of glomeruli, and also tubulus, you will see the compact formations of glomerulus and also tubulus. But in here, can you see the glomerulus here? No. What you see here is only enlarged tubulus, but without evidence of intact glomerulus. So this is characterized the disarranged or abnormal cell shape and structures. So this is related with dysplasia. Next, I would like to explain about neoplasia. Neoplasia is tumor. There are two types, the benign and also malignant tumor. Malignant tumor, we call it as cancer. So benign tumor and malignant, okay, usually it will be added at the end by the suffix oma. Here, if the neoplasia originated from the epithelium, there will be what we call as carcinoma. So this carcinoma means cancer that related with epithelial cells. If it's related with supportive tissue, like blood vessels, fibrous tissue, the tumor, we call it as sarcoma. Carcinoma, sarcoma are malignant. So benign with oma as well. But in cases of benign, usually, although not all type of tumor, it will be oma only. But if it's malignant, okay, there will be oma or noma if it's related with the epithelial origin of the tumor. Here, benign epithelial tumor, benign skin tumor that originated from epithelial cells, it means from the epidermis, we call it as papilloma. But if it's malignant, we call it as carcinoma. Here, this is the papilloma. I guess this is papilloma in the skin of dogs here. This is multinodular tumors. Okay, multinodular tumors. So how do we know if it's benign? Okay, we see on the histopathology. What we will see in the cases of papilloma is there will be disarranged growth of the epithelial cells, the squamous cells. Okay. However, the squamous cells, the orientations, the shape of the cell is dissimilar with normal. Okay. So if it's in cases of the malignant type of epithelial tumor in skin, in the squamous epithelia, for example, we call as the squamous cell carcinoma. Here, this is the pad, the foot pad of a dog with slight enlargement here. So the slight enlargement, actually a tumor. So what we will see under the microscope in the cases of squamous cell carcinoma, they do have epithelial cells, but they will have this arranged pattern. So usually these arranged patterns will be characterized by formation of materials we call as keratin pearls. In normal skin, in papilloma, we will not find this keratin pearls. And then we can see also in squamous cell carcinoma, the shape of the growth of the epithelial cells is usually irregular patterns, not like the papilloma with a more concentrated or well-seen pattern. The irregular patterns can be seen here, but the presence of keratin pearls is characterized the malignancy. This one here, this is a tumor in skin, I guess, in dogs. Okay, you can see here, this is a dark pigment here. This is a melanin pigment. This is cases of melanocarcinoma, or nowadays, we familiar with nowadays this kind of tumor usually called as the simple melanoma. So just like I said, usually melanoma before used to be used for benign tumor, but nowadays melanoma defined as the malignant tumor. Okay, before the name of malignant melanocytic cells tumor is melanocarcinoma, but nowadays it's melanoma. However, how about the benign type? Melanocytic tumor, the benign type, we call it as melanocytoma. Here, this is the melanoma or melanocarcinoma, melanoma. You can see here abnormal and irregular patterns of the epithelial cells of the melanocytic cells in the epithelial layers. Okay, now this one here, this is the bladders of dogs here. This is bladders of dogs with masses inside the urinary bladder. Irregular surface thickening also of the bladder mucosa here. Okay, and even also this mass, if it invade the tissue, it can cause also complete obstructions. Chronic obstruction will causing also retentions of the urine. So it makes enlargement of the PLM due to urine retention. Okay, so this is the part of the ureter with obstructions, and then urine retention occurs, and then the accumulations of urine will cause compressions to the surrounding tissue. This kind of things here with regular patterns like this, and you cannot see the clear borders between the tumors and the normal tissue. It usually characterizes the malignant tumor. Here, this is the lipoma. Lipoma means tumor that originated from the fatty cells. Okay, in cases of lipoma, this is a benign tumor. Benign tumors that originated from fatty cells, they will show just normal fatty cells, just more fatty cells, and it can be easily distinguished with the surrounding normal tissue. So this is the fatty cells tumor with well-differentiated cells. Well-differentiated means the shape of the tumor cells similar with the normal cells, and within the tumor there is clear borders with the connective tissue around the tumors. So usually this is characterized the benign tumor. This one is muscle of dogs, okay, and this is the tumor of the muscle, tumor of the skeletal muscles. If it's malignant, we call it as rhabdomyosarcoma. Rhabdo means skeletal. Rhabdo means skeletal muscle. Rhabdomyosarcoma means malignant tumor originated from the supporting cells that not categorized as epithelia. This one the tumor here, and this is the necrotic part of the tissue due to the tumor invasion. And then in cases of rhabdomyosarcoma, if we look under the microscope, there will be what we call as atypical cells. One of the signs of the atypical cells is size of the nucleus. Usually the nucleus will be large. Even the size of the nucleus will be similar with cytoplasm. And then the malignant tumors also indicated by metastasis. Benign tumor will be encapsulated. The size, the tumor expanded maybe, but it will be seen with clear borders with the surrounding tissue. Means the body tried to encapsulate the tumors, but in malignant, no. Okay, there will be invasions and also invasions to the blood vessels will make the tumor fragments can enter the bloodstreams and reach other organs. That's what we call as metastasis. Metastasis characterize only malignant tumor. Okay, so this is lymph nodes with lymph nodes in the, I guess this is the supramammary lymph nodes with tumors that actually originated from the carcinoma of the mammary gland. Okay, that's quite common tumors in dogs, rarely in cats, and the tumors, because it's malignant, invade the blood vessels, and the fragment of the tumors reach the bloodstream or reach the lymphatic vessels, and it flows into the surrounding regional lymph nodes. Here, this is the tumor mass, the white spot. This is the tumor mass inside the lymph nodes. And if we look under microscope, there will be these orange patterns and fragments, or we call it fragments of the tumor. We call it as the tumor embolus or tumor emboli. This is metastatic tumors of urothelial carcinoma that originated from the urinary bladders. The tumor reached the lung and also the liver. Here, this is the nodules of the tumor that reached the lungs, and the whitish spot here, this is the part of the tumor that reached the liver through the blood vessels. Here, multiple formations, small or large, or tumors outside the primary site, outside the original organs. Here, this is the sarcoma that that spread or metastasized into the lung. Okay, this one's this must be malignant tumor. Okay, this part here, this is the mass of the tumors, and this one here, this is the histopathology. This wavy pattern here, this is characterized the fibrous tissue tumor. We call it as fibrosarcoma. This is another examples of malignant tumors. One tumors that we can find in skin of animals. These examples obtained from dogs. This is the tumor on the skin. Okay, here. Tumor of the skin. You can see these big lumps on the skin. I guess this one here in the peripheral skin. And after we perform necropsy, we can see the shape of the tumor under the skin here. But this only by looking with our eye like this, we cannot sure what type of the tumor is it. Okay. And these tumors, these dogs also with the tumors here, also have smaller nodules in the spleen, kidneys, heart as well, lungs here. This is characterized the metastasis. So the original tumor located on the skin, this is the tumor, which is the mast cells. Usually mast cells, a kind of cells related with allergic reactions that located in the dermis. The mast cells can be tumors. From skin, it will be spread into the liver here. So this is your assignments on these materials. Okay, so I guess the submissions method of the assignment just similar with the previous one. Here, this is the assignments. This is the questions. The question is about here how to explain the difference between aplasia, atrophy, and hypoplasia, and select one case of neoplasia outside of this PPT and explain the definition, macroscopic and microscopic changes. Okay, that's all for the practice materials. I guess you can submit the reports as similar as the previous submission method. Thank you for today. Have a nice day.